needed to implement those programs. Our fifth and final takeaway that I'd like to highlight is that while counties work to respond, the financial and human cost of behavioral health needs is compounding across all county systems. When faced with the growing need for services and lack of workers, counties are forced to rely on other service systems to support residents with behavioral health conditions. 80% of counties are saying that they incur indirect costs associated with behavioral health conditions in their legal systems, that's their courts and their jails. Berry County, Missouri, for example, lamented that its government has no place other than the county jail to place residents in need of behavioral health services. We saw in Burt County, Nebraska, and Dallas County, Texas, both have residents with behavioral health conditions, especially those with severe conditions, who are waiting in jails for beds to open at behavioral health facilities. This results in overcrowding the jail and missed opportunity to provide optimal treatment. 77% of counties report impact on law enforcement department budgets. In Uintah County, law enforcement officers are spending a third of their calls for service on mental health needs and not necessarily calls for public safety issues. Now, although respondents mostly identified associated costs in the justice and public safety sector, about half of counties, more than half, 54%, are indicating that they incur associated costs in their public health systems and their hospitals. And the report details similar proportions of counties incurring costs in crisis response within their schools, across their human social service systems, and to their local economies. Wrapping up, counties are integral to the local behavioral health system of care. We invest $163 billion each year in community health, hospitals, and social services, as well as $107 billion in justice and public safety systems. In at least 33 states, counties may or are required by state law to provide traditional behavioral health services. But county leaders in every state are seeing increased needs, poor outcomes, and increased costs across their county systems. This report, I promise, isn't all doom and gloom. Despite the severity of the crisis and its strain on our resources, we found counties across the nation are reporting expanding direct and indirect behavioral health service systems to care for residents. We're standing collaborative and cost-sharing teams and programs, and we're making targeted investments in behavioral health care using American Rescue Plan resources. Counties are also advocating for federal and intergovernmental policies that support our goals of serving residents and addressing this mental health crisis. And you'll hear more about those policies momentarily. Those are the highlights of NACo's new research. I'm happy to take questions at the end of the program or connect you to NACo's research lead on the project. Thank you.
Thank you, Ashley. Sorry. Next, we'll hear from Commissioner Helen Stone from Chatham County, Georgia, and the chair of NACo's Health Steering Committee. Commissioner Stone will share highlights or insights around policy priorities as reinforced by this new data. Before I pass to Commissioner Stone, I'd like to remind any members of the media joining through our live stream that we will have time at the end to take questions from any of you who have some. So please use the Q&A function to submit your questions at any time. Commissioner Stone?
Good morning, and thank you so much, President Winfrey, and thank you for tasking this commission with such a deeply important role in advancing the health and well-being of county residents. With this presentation of the data that you just heard, I'd like to review the policy priorities that we are advancing for. First is amending the exclusionary policies under Medicaid. The Medicaid Inmate Exclusion Policy, or the MIEP, is a federal policy revoking the federal health benefits of people housed in prisons and jails, even if these people have yet to be convicted of any crime. Not only does the MIEP risk disrupting the very important continuity of care for individuals, it also is indefensible to deny people access to federal health care benefits while they're presumed innocent. To that end, NACo proposes amending the MIEP to allow individuals detained in pretrial to access Medicaid and other federal health benefits. Another exclusionary policy under Medicaid is the restriction on reimbursement for inpatient care in certain types of facilities, specifically psychiatric or other residential treatment facilities larger than 16 beds, which currently do not qualify for the reimbursement. Why? Modernizing the institutions for mental disease, or the IMD, accordingly, will reduce barriers to comprehensive behavioral health treatment. Next among our county priorities for mental health behavior is the strengthening of the mental health workforce. You've heard here today about the workforce shortage, and counties are calling on our federal partners to ensure direct and flexible resources to support the recruitment, the training, and retention of a sufficient behavioral health workforce. Third, we're advocating for investment in and alignment of local crisis response systems. Our nation's lack of an effective, widely available mental and behavioral health crisis service system has contributed to tragic outcome for people that are in crisis. We propose enhancing the intergovernmental partnership for the development and modernization of local crisis response systems and infrastructure. Finally, we support the enforcement of mental health parity. The Mental Health Parity Addiction Equality Act is a federal parity law enacted in 2008. This was requiring comprehensive standards for equitable coverage of mental health and substance use disorder treatment and coverage of physical treatment. We propose advancing federal state legislation that incentivizes and enforces the existing parity policy and ensures that the laws are uniformly implemented. Each of these priorities will help us alleviate the mental health crisis and promote better outcomes for all. Thank you all very much.
And thank you, Commissioner Stone. Next, we'll hear from Commissioner Therese Brown from Allen County, Indiana. Commissioner Brown will provide valuable perspectives on how the mental health crisis is playing out in rural America. Commissioner Brown.
Thank you, President Winfrey, and thank you for the opportunity to be here not only today, but to meet such wonderful individuals that bring such a clarity to a subject that is desperately needed to be addressed today. As President Winfrey said, my perspective will be bringing a level of rural Allen County, Indiana, Northeast Indiana perspective. As you found today, the research findings here will be familiar to many counties across this country and will not be excluding anyone, no matter how large or how small. But I'd like to take a few moments to highlight our experience in Allen County, Indiana, and where we see opportunities to address mental health and behavioral health challenges. Allen County is like no other, is like other counties throughout the country, with only 40% of the individuals needing mental health services in any year getting those services. Of those, 50% get mental health services from their primary care physicians. The remainder are getting them from mental health professionals. With the substance use disorder, the percentage is even lower, only 8% in any given year that are in need of substance treatment use need and get those services. And there are many factors on why people don't receive those treatments. Stigma, cost, fragmented entry points to get mental health treatment. Allen County is addressing these access issues by implementing various programs throughout the community. Heart teams, which are plainclothes police officers and social workers who visit homes of people after they have had an overdose and allow the individual the opportunity to find out what services are available to them if they want it. This at least gives that soft touch for individuals to be able to know that there are opportunities for them when they believe they have the opportunity to address their issues, the entry point to do that. Peer support recovery specialists. These individuals are the individuals that go into the emergency room and review all of the admissions for overdoses in the community, whether it's the same day or prior days, and then reach out with those individuals to also allow them the opportunity to be able to find out what services are available to them, to be able to connect them and coordinate them with that treatment, and also to maintain contact with them. It doesn't stop once they have that initial interaction. It's continual. We have jail assessments to place inmates in residential treatment. We have a lot of different court systems within our jurisdiction where individuals, when they enter the court system, if meeting certain criteria, have the ability to be able to be placed in these diversionary programs, and then also be able to give them those types of assessments so that we can get them the treatments and the necessary opportunities to be able to address any type of issue that they may have. Some of those are working through our community corrections program, where individuals, whether through day reporting, still maintaining a job, have the ability to have services through a marketplace of opportunities for programs to be able to address mental health, drug addiction, as well as domestic issues and child rearing or any of those other issues that they may be lacking in that area. But also individuals that may be needing to serve out their time. Those individuals may be placed in a residential setting versus being incarcerated in the brick and mortar of a full-fledged jail. They still may be able to go and perform a job, but they also would then be required to do a lot of different self-reflecting things, as well as going through programming that helps with them and getting their mental health and their substance abuse hopefully into check. We also have mental health liaisons for the jail. As they're coming into the jail, they're being assessed so that whatever their needs are, they are being addressed and worked through with jail staff and other physicians, whatever uses or things that they may have in their system. We also have then individuals working on the mental health side that are doing face-to-face mental health and substance abuse disorder assessments in the emergency room so that individuals can be assessed at that time. As well as most of us here in this room are very well aware of 988, so we're diligently working towards implementing 988, not just in Allen County, but across the state of Indiana. So I want to thank my colleagues. Again, this has been a very robust, very whirlwind week, 2 days, seemingly packed into 2 days, but ultimately very, very helpful, very, very timely, and something that we need to be addressing yesterday. So thank you very much.
And thank you, Commissioner Brown. Our next speaker is going to give us the other side of that coin, the urban perspective. Supervisor Catherine Barger from Los Angeles County, California, who is also the co-chair of this Commission on Mental Health and Wellbeing, will speak next about the urban perspective.
First of all, thank you, Dr. Winfrey. I just elevated you. President Winfrey, on behalf of myself and co-chair Executive Dow Constantine of King County, Washington, I'd like to thank the Commission for joining us in Washington this week for this event. And I agree, we've packed a lot into 2 days, but there is no question that this issue touches everybody's life in every single county. As President Winfrey mentioned earlier, we'll be departing shortly for Capitol Hill, where we look forward to sharing the data released today with our federal partners. I'd like to follow Commissioner Brown's remarks with another example of how we see these issues and solutions playing out in our counties. Earlier this year, California received the first of its kind waiver for the Medicaid inmate exclusion policy. This waiver will ensure justice-involved people in jails and prisons will be connected with community-based Medicaid providers 90 days before their release. This waiver allows us to sustainably scale up our continuum of care in the community, leading to better outcomes and lower rates of recidivism, something that we all strive to achieve. To adequately address the challenges in our justice system, we need long-term solutions, and this is not possible without federal funding flexibility. This example demonstrates the potential of America's counties to partner with state and federal government as we work toward policies that support our residents' mental and behavioral health needs. We're also advocating on behalf of modernizing the IMD exclusion, which will allow us to more efficiently build out our mental health bed capacity. In closing, I'll say that our work this week, in alignment with the work of counties across the U.S. during Mental Health Awareness Month, is an important step as the Commission pursues our goals. The gravity and urgency of this nation's mental health crisis demands ongoing attention and action at all levels of government and in partnership with all sectors. I look forward to continuing this work in the coming weeks and months. I'm hopeful that we will achieve our goals, strengthen mental health and well-being, and help to build a better future for the millions of people who are suffering with mental illness. Thank you.
Thank you, Supervisor Barger. And thank you to the members of the commission for your work, not only this week, but in the weeks and months ahead. And also thank you to the NACo staff for putting this together and helping us to get this off to a great start. So thank you to all of you. I can barely see you around there, Megan. Thank you. Just want to remind you all as you're watching us that if you have questions, you can put them into the chat and we'll take those through the live stream. So with that, do we have some that we'd like to answer?
We do. We have one question so far from the Washington Times asking President Winfrey for your perspective on the significance of this new research.
I think this new research is absolutely vital. As I said earlier, the head is a part of the body. We have to recognize that if people do not have mental health, they do not have health, period. There's no other way to put that. The mind drives the body. If you don't have that piece, you don't have anything. And you may function for a while without that, but sooner or later you go downhill. So this is absolutely vital to the health and well-being of our nation. Our children need that, our adults need that, our seniors need that. There is not anyone in this world who does not need the support of mental health. It is absolutely a necessary thing, and we need to get a handle on this. And that's my position on that. Do we have other questions? Okay, so then I'll just close by saying that this week's presence here in Washington is just one part of county's participation in Mental Health Awareness Month, which we recognize throughout the month of May. And I want to celebrate and thank all the counties across America taking meaningful action this month and beyond to move the needle on mental health, because we absolutely do need it. Thank you.
President Winfrey, we do have a late-breaking additional question.
Okay.
We have a question from CQ Roll Call. As you are meeting with Congress today, good morning. Parts of the Support Act 2018 opioid law are up for reauthorization this year. I wanted to ask, as you are meeting with Congress today, if some of these priorities align or there are ways to build on that. IMD, which you mentioned, made some changes in 2018.
That work for you? I'm going to ask Dr. Burke to come up, and if there are other members of the commission who can speak to that, to join her here so that we can answer that question.
So the Opioid Act and the focus on opioids is extremely important to everything that we're doing. It's not a different problem. And I think that's really important that we understand that these are all connected. So it's important that we stop looking at something like, oh, it's the fentanyl problem. Oh, it's the opioid problem. Oh, it's the cannabis problem. It's all connected. And those substances all impact people in different ways. And so collaborating with all the dollars coming together has been very successful in our community. SAMHSA has done a tremendous amount with opioid dollars. And I'm really anxious to see how we can continue to connect all the different resources that are available out there. Sound good?
I believe Commissioner Stone tried to come up. And are there other members of the commission who would like to speak to this issue?
No, I was just going to say that through this authorization or reauthorization, this would certainly help with the MIEP, the Medicaid inmate exclusion policy, as well as the Medicaid, what's the other one? Yes, the 16 bed exclusion. Yeah, and that's the IMD. Thank you. I'm sorry. But this is important because if you cap beds at 16, then that's limits the number of people that you can help. So all of this is extremely important. So this is just great, y'all. This has been a great team. We've got a great leader, and I really appreciate this.
Catherine? Yeah. Commissioner Barger, if you'd like to speak to that.
So I'll just follow up. As it relates to the legislation, I understand that it was a temporary fix as it relates to substance abuse. So we would like to see that a permanent fix using the IMD funds on a long-term basis, because we know that that we have to fix the system, and many of those that are in crisis with mental health and substance abuse co-disorders, we need to plan way out in the future. So this can't be a temporary fix. So we will be advocating for permanency as it relates to that.
So, mental health is an ongoing issue. As long as we have people, we have issues around mental health. So we need to always continue to work on that, use whatever is available to us to move that needle forward. So if we have other questions?
I'm pretty sure this time we do not.
So, thank you all for joining us on this live stream program. We hope that you'll continue to carry forward the need, the importance of mental health, write about it, talk about it, share it with others around you so that we can get the whole country behind us in this effort. Thank you.